Hey everyone, so today we are going to talk about the topic brachial plexus. It is one of the most important topics in upper limb. Brachial plexus is a plexus of nerves formed by ventral rami of lower four cervical nerves. Rami as in the branches of lower four cervical nerves as in C5, C6, C7 and C8 and first thoracic spinal nerve that is T1. Sometimes C4 and T2 also may be involved. If more of C4 component is involved and T2 is absent, then it is called as prefixed brachial plexus. And if more of T2 component is involved and no C4 component, then it is called as postfixed brachial plexus. Then coming to the components of brachial plexus. The components of brachial plexus are roots, trunks, divisions and cords. And also we have the branches. We can remember the components of brachial plexus by a simple mnemonic, that is R, T, D, C, B, as in roots, trunks, divisions, cords and the branches. Now let's talk about the roots of brachial plexus. The roots are constituted by anterior primary rami of C5 to T1 spinal nerves. So here we have the roots which are constituted by C5 to T1 spinal nerves. These roots are located in the neck deep to scalenus anterior muscle. The roots are located behind the scalenus anterior muscle. Then we have the trunks. The formation of trunks can be easily appreciated in this picture. So here we have C5, C6 roots which are forming the superior trunk. C7 alone forms the middle trunk and C8, T1 forms the inferior trunk. So basically we have three trunks, C5, C6 joining to form the upper trunk, C7 alone forming the middle trunk and C8, T1 forming the lower trunk. The trunks lie in the neck. They are located in a cleft between scalenus medius behind and scalenus anterior in the front. That means trunks are present in the neck and they are also present in the cleft between the scalenus medius and the scalenus anterior muscle. So here we can see the roots, and behind this we have the formation of trunks by these roots. Coming to the next component of brachial plexus, that is the divisions. All the trunks give rise to two divisions, that is anterior and posterior divisions. So we have three trunks as we have already seen the trunks. Then the next component is the divisions, where we have as anterior or posterior. So superior trunk or upper trunk gives rise to anterior division and posterior division. Middle trunk gives rise to anterior division and posterior division, and inferior trunk also gives rise to anterior division and posterior division. So the location of the anterior and posterior divisions of brachial plexus, they are located behind the clavicle. So here we can see the clavicle, and behind the clavicle we have the divisions of brachial plexus, that is anterior and posterior divisions of brachial plexus. Now let's talk about the cords of brachial plexus. The cords of brachial plexus are three in number. So we have the lateral cord, medial cord and the posterior cord. So this is the lateral cord, this is the medial cord and this is the posterior cord. The lateral cord is formed by anterior divisions of upper and middle trunks. So this is the lateral cord, the upper trunks its anterior division and the middle trunks anterior division. Both of these form the lateral cord. Medial cord. Medial cord is formed by the anterior division of lower trunk. This is the anterior division of lower trunk alone forms the medial cord. Then you have the posterior cord. The posterior divisions of upper trunk, middle trunk and the lower trunk together form the posterior cord. So this is the posterior division of upper trunk, then posterior division of middle trunk and the posterior division of lower trunk together form the posterior cord. This is about the cords of brachial plexus. Then coming to the branches of brachial plexus, an important point to note that is all the parts of brachial plexus, that is roots, trunks, cords, all of them give rise to branches except the divisions. it is an important question. That is, all parts of brachial plexus give rise to branches except the divisions. So here we have the divisions and we see there are no branches for the divisions. Branches of brachial plexus. So the branches which are directly arising from the roots, we have long thoracic nerve and dorsal scapular nerve. Long thoracic nerve is also called as nerve to serratus anterior. It supplies the serratus anterior muscle. It is coming from the roots C5 to C7. For this nerve, we have an important correlation, that is damage to long thoracic nerve causes winging of scapula. Another nerve arising from the roots is the dorsal scapular nerve, which supplies the rhomboids and the levator scapular muscle. Now in this diagram, let's see the branches which are arising from the roots directly. So here we have the dorsal scapular nerve, and which is dorsal scapular nerve which is supplying the rhomboids and levator scapulae, and this is the long thoracic nerve which is supplying the serratus anterior. Then we have the branches which are arising from the trunks. There are two nerves, that is suprascapular nerve and nerve to subclavius. So here we have the suprascapular nerve and here we have the nerve to subclavius, which are arising from the trunks, that is mainly from the upper trunk, which gives rise to two branches, that is suprascapular nerve and subclavius nerve. Then we have branches from the cords. From the lateral cord, there are three branches which can be remembered with a simple mnemonic, that is LML, as in lateral pectoral nerve, musculocutaneous nerve and lateral root of median nerve. Now let's see it in the picture. So this is the lateral cord which is giving rise to lateral pectoral nerve, musculocutaneous nerve, and this is the lateral root of median nerve. So this is the median nerve here. The lateral root comes from the lateral cord. Then we have the medial cord. So medial cord has totally 5 branches which can be remembered by a simple mnemonic m to the power of 4 u, that is 4 m's and 1 u. So the branches are medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial root of median nerve and the ulnar nerve. So these are the 5 branches of medial cord. Now we can see it in the diagram. So this is the medial cutaneous nerve of forearm, medial cutaneous nerve of arm, this is the ulnar nerve, this is the medial root of median nerve and the medial pectoral nerve. So these are the 5 branches of the medial cord. From the posterior cord, the branches can be remembered by a simple mnemonic, that is ulnar. That is upper subscapular nerve, lower subscapular nerve, nerve to latissimus dorsi, axillary nerve and radial nerve. So 5 branches. Here also we have the 5 branches. So let's see the 5 branches now. This is the upper subscapular nerve, lower subscapular nerve, thoracodorsal nerve or nerve to latissimus dorsi. This is the axillary nerve and this is the radial nerve. So these are all the branches arising from the different cords. Now coming to Erb's point. Erb's point is the region in the upper trunk of brachial plexus where 6 nerves meet. Now let's see what are the 6 nerves which meet at Erb's point. So we have C5 and C6 cervical roots which join to form the upper trunk, and we have suprascapular nerve and nerve subclavius from the upper trunk, and lastly we have the upper trunk dividing into anterior and posterior divisions. So this is the Erb's point. We have an important clinical correlation for Erb's point, that is Erb's palsy, which we'll see in the later segment of this video. Now let's see which segment of brachial plexus does which action in the body. C5 segment of brachial plexus controls adduction of the shoulder, that is adduction of the shoulder. C6 and C7 segment controls abduction of the shoulder, which is quite opposite to the C5 segment. Then we have C5 and C6, which controls flexion of the elbow. C6 and C7 controls extension of the elbow. C8 and T1 segment controls flexion of wrist and fingers. Now let's see the important lesions of brachial plexus. Erb's paralysis. It is also called as upper plexus injury. The most common cause of Erb's paralysis is due to excessive increase in the angle between head and shoulder. So there's excessive increase in the angle between head and the shoulder. It commonly occurs in falling on the shoulder when the person falls from the back of a horse and landing on the shoulder. So and also in traction of the arm during birth of a child. So there is aggressive pulling during the birth of the child, which may also lead to Erb's paralysis. Here C5 and C6 are commonly involved. That is, the upper trunk is involved, so it is called as upper plexus injury. And the deformity here seen is policeman step or waiter step. So here we can see the hand of the baby, which appears like a policeman borrowing a tip. The main features of this paralysis are abduction of the arm. So there's abduction of the arm, and that occurs due to paralysis of the deltoid muscle. There's also medial rotation of the arm, as seen here in this part, and that is due to paralysis of the supraspinatus, infraspinatus and teres minor muscles. There is also extension of the elbow. This extension of the elbow occurs due to paralysis of the biceps brachii at this point. And there is also pronation of the forearm. Pronation of the forearm due to paralysis of the biceps brachii muscle. And in sensations, there is loss of sensation in the outer aspect of the arm. There are also sensations lost in the outer aspect of the arm. So these are the important features of Erb's paralysis or upper plexus injury. Klumpke's paralysis. Klumpke's paralysis occurs due to hyperabduction of arm, which may occur when the person falls on an outstretched hand. That is, hand is already outstretched and there is hyperabduction of the arm. That is, the hand is away from the body and the person falls. Or it may be due to pulling of the arm of the baby during delivery, that is extended arm breach. So there is hyperabduction of the arm, that is movement of the arm away from the body, and there is pressure. The nerve roots involved are C8 and T1, that is a lower trunk. So Klumpke's paralysis is also called as lower plexus injury. Now let's see the features of Klumpke's paralysis. There's a complete claw hand. The complete claw hand is due to paralysis of flexors of the wrist and fingers and intrinsic muscles of the hand. Previously we have seen that there is if C8 and T1 is injured, the flexion of wrist and fingers, that function is lost because C8 and T1 controls flexion of wrist and fingers. So here in lower plexus injury, we see complete claw hand, that is due to paralysis of flexors of wrist and fingers and intrinsic muscles of the hand. So this is the claw hand. And there is also loss of sensations along the medial border of forearm and hand. There's wasting of forearm muscles and intrinsic muscles of the hand, and there's also loss of sensations along the medial border of forearm, that is this side, medial border of forearm and the hand. And there's also an important feature, that is Horner syndrome, where we see ptosis, anhidrosis due to the involvement of sympathetic fibers supplying the head and neck, which leave the spinal cord through T1. So T1 is affected here, so there's also Horner syndrome, which is an important clinical feature in ophthalmology also. So we see meiosis, anhidrosis, ptosis, lag ophthalmos and enophthalmos. Now here we can see the difference between Erb's palsy and Klumpke's palsy. Nerve roots involved in Erb's palsy are C5 and C6, and here it is C8 and T1. The muscles paralyzed in Erb's paralysis are deltoid and the sits muscles, biceps brachii, brachioradialis, and some other muscles. Whereas in Klumpke's paralysis, the intrinsic muscles of hand are mainly involved. So the position here we see is a policeman step or waiter step, and here we can see claw hand deformity. The sensory loss in Erb's paralysis is along the outer aspect of arm, and in Klumpke's palsy there is along the medial border of forearm and hand. Here there are no autonomic signs, but here we have the presence of Horner's syndrome, which we have already seen is due to involvement of sympathetic fibers. So this is all about brachial plexus and its injuries. Please like, share and subscribe.